I'm Dr. Cristin Mathew from Houston, Texas, and I'm an orthopedic sports medicine surgeon at All American Orthopedics and Sports Medicine Institute in the Clear Lake area by NASA. Some of the questions I've been asked to answer are, what kind of physician are you and what kind of training did that involve? So I'm an orthopedic sports surgeon, which means I'm a bone and joint surgeon. I specialize in minimally invasive surgery, which involves my sports medicine training, but I also perform joint preservation techniques, trying to prevent joint replacements, but I also do robotically assisted joint replacements. My experience in my training was a little unique. After high school, I did 4 years of undergraduate training at Ursinus College, then later went on to do a post-baccalaureate program at Drexel College of Medicine in Philadelphia. From there, I went on to do 4 years of medical training at the Edward Via College of Osteopathic Medicine in Virginia, on Virginia Tech's campus. From there, I went to New York and did 5 years of residency at Northwell Health in Long Island, and then came back down to Houston at Houston Methodist and did my fellowship in sports surgery. In residency, we also learn how to manage things from simple hand fractures to the complicated pelvis fractures, when you see someone that's hit by a car and trying to piece them together. So orthopedics has different subspecialties within it as well. There's pediatric orthopedics, which involves taking care of kids, foot and ankle, hand, shoulder and elbow, spine, tumor, sports, which is what I do, reconstruction. There's also trauma, which involves taking care of fracture work or patients that have broken bone. Now, what does fellowship entail? In orthopedics, fellowships are typically 1 year. However, tumor or cancer is 2 years. Now, during my fellowship year, I had the unique opportunity of working with all the professional teams in the city, which included the Astros, the Texans, the Rockets, as well as the Dynamo, and also the Houston SaberCats, which is the new professional rugby team. Now, I got to work with those athletes on the sidelines. I helped cover their training camps, as well as also saw them after practices too. The interesting thing about orthopedic sports medicine and also being a sports surgeon is that your job starts before the game, extends through the game, and after the game. So oftentimes as everybody else is relaxing later in the evening, that's when you're revving up. And that's only after you've also completed a full day of treating patients on your own or operating on them during a regular schedule. Now, there were some days where I would come back extremely late, like at midnight, but that being said, it was also really exciting because I was a part of some amazing wins and historical experiences of the city. What does my typical day look like? Well, it varies a lot. Typically 2.5 days out of the week I'm in clinic, and clinic means seeing patients in my office. So this includes patients that are presenting themselves for the first time with an injury, like a high school student who may have tripped and fell and broke their ankle, or was trying to avoid somebody on the field and they tore their ACL, to a grandmother who fell and broke her wrist. So I have a wide variety of patients, and I see a wide variety of injuries from breaks in the wrist and hip and knees to ligament ruptures or other cartilage or bony issues. And that typically goes from about 8 to 5 every day, where I see about 40 to 50 patients. Thereafter that, I kind of finish my notes, and that can take a couple hours, but I can also do that at home too. The rest of the week, I'm typically operating. And what that means is that I'm going to the operating room and I'm actually taking care of these patients that I couldn't get better with non-operative measures, whether their fracture was too bad and they needed surgery, or they just weren't getting any better with medications. So in these situations, I take them back, and my practice actually revolves around a lot of joint preservation techniques, which involves injections as well as minimally invasive surgery, which we call arthroscopy in orthopedics, to full-on joint replacements, or what we call reconstruction. And in those situations, we're actually cutting out the arthritis and actually putting in new surfaces, so that way the arthritis or the worn out joint isn't rubbing against itself anymore. Now, the OR days can vary a lot because each procedure can have a very long variation in how long they can take. Um, Typically, my joint replacements take about an hour to an hour and a half, so I get about 4 to 5 done in a day. Otherwise, my scopes, depending on what needs to be done, like a simple cleanup, can be about 15 to 20 minutes, and I can schedule about 8 of them to 12 of them a day. What made me decide to become an orthopedic surgeon? So, I always knew I wanted to be a physician because I had a father who was a physician, and that was something we bonded over, was science. From there, my passions in anatomy and physiology grew through undergrad, but I didn't know what kind of doctor I wanted to be. I had a unique experience with an orthopedic surgeon when I was 16 when I tore my ACL playing football. And he let me shadow him, and I thought it was a really cool opportunity. And one of the nice things about the field is that it allows you to not only use your mind, which every other physician uses, but it also allows me to heal patients with my hands. So I can actually structurally say, hey, I got that fracture or that break exactly where it needs to be, right back to the way someone was made or born, and I was able to hold it in place and allow their body to heal it. So I have objective findings that I can see and make sure I make patients better with. Now, what courses in my undergraduate and graduate training did I find the most helpful for me? Well, as a surgeon, anatomy is the most important thing. Your anatomy is what can make or break you, and you need to know where things start and where things end, and variations of the sort. Along with that, physiology, and in my specialty, kinesiology. My minor in undergrad was human performance assessment, which allowed me the opportunity to see how athletes are tested and also have an understanding of how to treat them on the sidelines as well as in the clubhouse. Now, what kind of extracurricular activities did I participate in out of my regular coursework? Well, I would say that I was a little bit of an anomaly. In undergrad, I was in a fraternity. I was also playing rugby pretty actively, and also I did student government. I was president of my class and vice president of the student body. So I did wear myself pretty thin. But one of the things that I learned during those periods is it's not necessarily working hard, but it's working smart. What I mean by that is knowing the best way you're going to learn. And for me, I learned best in the mornings, and I learned best on my own. I also learned best when I was hearing things over and over again. So one of the things that helped me maximize my limited amount of time is that I would record my lectures and then play them as I was working out or in the car or running around, walking between classes. And this would help me reiterate the knowledge over and over in my head so I'd be prepared for my exams. Now, there's a lot of people that could stay up all night and study, and I just wasn't one of them. I needed my sleep, or I needed to be listening to my lectures. So in those situations, I just found myself, hey, if I need to sleep and I'm not going to be productive trying to study this late at night, then I need to just be productive in the morning and learn how to work smart and not necessarily work hard, which is an important thing you have to try to learn while you're in undergrad in your master's program. Now, while in medical school, I was also president of my class and vice president of the national student body. I also did play rugby too, so I did a lot more than a lot of other medical students did. But at the same time, it was because I knew how to work smart. So when I was traveling around the state playing rugby, I would be listening to my lectures in the car, or when I was in the gym, I'd be reiterating my anatomy lessons. So those are ways of being able to balance their coursework. Now, I wouldn't advocate this for most people. I know I'm really lucky in that I'm able to learn this way. But the most important thing is learning how you learn and what's the best way you learn, and maximizing that. A lot of people would ask me how I maintain my focus during med school and during all this training, and organization is key, along with discipline. Now, you can have a great time and enjoy your life, and I would say med school was some of the best years of my life, but organization is key, and having discipline to knowing when you have to cut it off and when you have to rev up certain things and prioritize your life. Now, Med school is it's a commitment. There's a lot of things you're going to miss out on, whether it's family engagements or friends and other people calling you out to have a good time. And unfortunately, you just have to prioritize. Remember that medicine's a calling. But that being said, if you're smart about it and you really plan, you can take advantage of a lot of things and experience a lot of awesome stuff during those years of training in med school. I would have to say my most recent accomplishment is my son. As much as I've grown a lot professionally, I think back and I say I've worked all the way this far to have a family, and I have a beautiful wife and a son, and my son is one. I'm expecting another baby on the way. And I would have to say those are my biggest accomplishments. Sure, financial, academic, as well as professional things have grown a lot in the past few years, but I would have to say my biggest accomplishment is my family. So the biggest key points of this video and kind of my life in orthopedic surgery, I'd have to say is, medicine is a calling. It's something that you pursue and you give up a lot to obtain, but that being said, it's a very noble profession. Orthopedic surgery is extremely competitive. You have to be pretty high up in your class or with along your scores as well as your personality. It's a huge team environment, and in the operating room, you're the leader, so you have to have good leadership skills to help coordinate and make sure your team or the people around you are in good morale and are productive. One of the things that I really like about orthopedics is the high-intensity nature of the profession. It's a lot of carpentry. There are saws, there are hammers, there's bone cement, there's expensive implants. There's also an art to it in repairing soft tissue and also rehabbing patients. Orthopedics is a very, very unique field of medicine, and you have to have a significant self-drive to learn it. It's not really taught in medical school except for anatomy, and most of your training really occurs in your residency. The field itself requires somebody that needs to be self-driven and self-motivated to learn, because nothing's really spoon-fed to you. But that being said, that self-driving nature is also the cool parts of orthopedics, and that's also why the field is rapidly evolving, because you have a lot of people that are self-driven, always trying to find better and more innovative ways of handling the problems that we see today. Now, after medical school, trying to get an orthopedic residency is extremely competitive. Typically, most folks that match orthopedics have to be the top 20% of their class, and that involves doing well on your exams, as well as your rotations and also your boards. In my experience, the first few months of my fourth year of med school were essentially auditions, where I would travel to different hospitals for a month and showcase my knowledge, my work ethic, and my personality, because orthopedics is a 5-year residency, so the program directors as well as the other residents want to make sure that you're a good fit for the program. There is a high intensity nature to it and a high pressure situation, so it's important that you can work with people that you can trust. Now, what does residency entail? Residency is a 5-year program where you learn to manage your patients both in a clinic as well as in the hospital and the operating room. While you're managing patients in clinic, you're learning how to evaluate patients and figure out what's wrong with them. You're learning how to read imaging like x-rays and MRIs. Alongside with that, you're determining which patients would be good for surgery, which patients would be bad for surgeries, and providing them the options and allowing them to decide. Alongside with that, when you get into the operating room, you're learning how to operate like a surgeon. That includes learning how to use instrumentation, learning the anatomy, making sure you can preserve anatomy, and also be a leader in the room. as a surgeon, it's your job to make sure that the room stays focused, the patient does well, and that there's good morale, because as a leader of the room, it's important that your room stays motivated. In orthopedics, there are a lot of people that are working hard, whether it's holding an extremity, holding an instrument. It's a physically taxing job, and so it's important to have a leader in the room that can instruct and encourage and also refocus everyone when it's needed. That being said, after the operating room, it's important to understand how to manage your patients post-operatively, how to control their pain, how to prevent complications, how to recognize complications, and help mitigate those.